Hi, my name is Dr. Nikki Green. I practice on the west side of Fort Worth, Texas, and I'm happy today to give a reducing insurance dependence tip to the thriving dentist community. So a question that often gets asked is, what are some of the things that you feel are important to put in place prior to, or at least at the same time, as someone who is considering dropping dental insurance plans? And for me, one of the very most important things to put into place internally is a great customer service systems and attitudes by yourself and your team, as well as a great marketing plan. So, I'm a firm believer in if you're going to reduce your insurance dependence, if you're going to try to start dropping insurance PPOs, which are basically discount plans, then you can't charge more for the same service or charge more for less than service. So, you've got to put, and what patients really feel is they feel the level of customer service that you and your team provide. Unfortunately, or fortunately, however you choose to look at it, patients don't often know the difference between your filling and a filling from a PPO practice, but they know the difference in the way they were treated by yourself and by your team. So you've got, in my opinion, we've got to put some of those customer service things in place prior to dropping insurance plans. Just simple things as much as, the greeting on the phone, smiling on the phone, never answering the phone, doctor's office, can you hold please? Always addressing patients by name when they come in the front door, having a picture attached to their chart so that your front desk receptionist knows who's walking in the front door. Something that I've instituted in my practice is something as simple as a dinner on me promise. And basically what that means is if we don't seat you within the first 15 minutes of your appointment, then you get dinner on us. And we hold true to that 100%. If we don't seat a patient in time, then they get dinner on us. Just some things like that to differentiate the level of customer service available in your practice as opposed to the PPO practice that is for sure down the street. Another thing I think is important is marketing, whether that be internal marketing systems, of patient referral systems, asking your patients for Google reviews. Those are so incredibly important. Stuff like that that's going to allow you to replace the potential patients that you may lose when you drop PPO plans. And if you can replace, your goal is to replace those with fee-for-service patients or, even patients who maybe have dental insurance but are willing to go out of network for those services. And trust me, those patients are out there. But you have to offer them something different than what they're getting down the street. So those two steps, in my opinion, are critical as you're preparing to drop insurance plans. Create exceptional customer service. A great book out there to know about that is Fred Joyle, Everything is Marketing, and then Creating a Remarkable Practice, I believe, is the second book. Both of those books are excellent resources for how to improve your systems within your office to create exceptional experiences that patients are willing to pay out-of-network fees to be a part of. And then secondly, of course, is increasing your marketing, whether it be internal systems, external systems that you're actually paying for, however you choose to go about doing it, whatever your practice budget will allow, but doing something to replace those PPO patients that you may lose and replacing them with valuable fee-for-service patients who value what you have to offer in your practice. So I hope this tip helps. I have made the journey of dropping PPOs, and it is definitely a journey I am happy that we did. I did it with the help of Gary Takis, and it's definitely one that I would do again. In fact, if I had a change to make, I would have done it sooner. Hope this helps, and happy Monday to you guys out in the thriving dentist community.